So do you guys remember Katie Price?
Never heard of her.
No? Trey?
I don't know who that is.
No, I was trying to figure out I've heard of Kelly Price, but not Katie Price.
All right, so Katie Price was really, really big, and she was kind of like a British supermodel, and like she was kind of a reality star, like one of the first ones, and she kind of blew up before social media was big.
Yeah.
So she's 45 years old. Like I said, she's British. She started out as a model, reality star. Now she's an author. So she was on a podcast recently talking about plastic surgery, which is kind of, I don't know, say ironic, I guess, because apparently she's had a bazillion plastic surgeries.
From this picture.
Yeah. And so she was on like the How to Fail with Elizabeth Day podcast, which I wasn't familiar with that one. I'm learning more about these podcasts because these news articles are popping up from people talking on podcasts. And she said there's nothing worse than women in their early 20s getting cosmetic procedures. And then she said she wants to educate people about the dangers of plastic surgery and the dangers of getting things too young. And of course, people obviously jumped on her because she's had a lot of plastic surgery. In fact, I read that she's had 15 breast surgeries. That's not good. I mean, you never want to have that many surgeries.
That doesn't sound very good.
Yeah, and apparently she's got...
scary.
Well, yeah, and so leading into that, I want to show her a picture of back when she was like a young model. Hey, she's a beautiful girl, looks like she could be a model. Look at the picture of her today, Travis. There's another one in there. I mean, she kind of looks like the same person, but man, she's got enormous breast implants. Oh my gosh, like that is not good for your body. I mean, I do agree with her on that getting 2,000 cc implants is potentially harmful. She's 100% correct. So anyway, this girl, she's kind of been in the news a lot, I guess, because she's one of those people who like shot to fame and then kind of everything went bad for her. Like she's had like a bunch of divorces, and she's got like in trouble with the law, and she's had to declare bankruptcy, and I think she's on OnlyFans now. I mean, it's kind of just
at
like...
least she doesn't have a tattoo on her face,
That is true.
Sometimes I feel like when celebrities...
they
just randomly get women, like female celebrities, they'll just randomly get a tattoo on their face.
Okay, I thought you were talking about Tyson. Like Tyson's like awesome. Like his tattoo, that's the one person I think that pulls off the tattoo on the face.
I think he's the only one that should be allowed.
Yeah, I think so. Mike Tyson, like he can pull that stuff off. Like
maybe Post Malone, he has them all over his face.
Yeah, I don't really dig Post Malone's face tattoos though. Like Tyson, I think he looks awesome because he's Mike Tyson, man. The guy can like do anything, and I'm like, yeah, it's cool. But yeah, no, she didn't have a face tattoo. But yeah, so
she has that going for her.
So she's had a ton of surgery, and she's now coming out saying that these things were damaging for her. Well, I mean, I agree. I mean, there are some things about what she's saying that I do agree with, and I think it's worth mentioning that when people get too much plastic surgery, it can be dangerous.
Definitely.
I mean, we've talked about that a million times where people go out and they do something, and then they keep adding on to it, getting more filler, or, getting bigger implants, or, they keep going down this rabbit hole of getting surgeries, and eventually it catches up with you.
Yeah, it's like they're like chronically unsatisfied people.
Yeah.
And I think it would happen regardless if it was with plastic surgery. That was just the route.
Right. It could be anything.
Yeah.
Yeah, I mean, you're right. I mean, there is like there is a potential for it to be kind of a mental issue where they're just like, keep doing something, keep doing something, keep doing something. And, unfortunately with surgery, I mean, the more you do, I mean, there is a risk every time you have surgery. And I'll tell you that plastic surgery is very safe. It can be done extremely safe with very, very low risks. But when you start to do too much, either do too much at once or do too much in series, or you take things to extreme, whether it be getting too much filler or getting giant implants, I mean, you can get into trouble.
Yeah, like your tissues start not being able to keep up with it.
Right.
I would imagine I would hope doctors are like, no, we can't do that on your breasts anymore.
Well, I mean, that's part of the problem is that I agree with you 100% that the doctors should say no. I mean, I definitely am happy to tell people no, but I'm in a better position because when you're really busy and you have a lot of business, you're not worried about keeping the lights on in your business. It's easier to turn people away. you know, and I mean, it's sad, but I think that some of it is just related to money that, you know, some people just, they got to keep doing procedures and they kind of let the patients run the show. Which,
Right.
I mean, obviously you want to give patients what they want, right? I mean, but it has to be safe, and, you know, patients don't always know what's safe.
Yeah. I
So-
wonder if like she goes to like a surgeon that's just known for giving big implants. Like that's what they're known
Those
for.
do exist. Yeah, those do exist where,
Like they just have a certain body type or
yeah,
theme that they use.
right, that they're going for.
Yeah.
Yeah, I met a patient a few years back that had, I want to say it was 3,000 or 4,000 cc implants. Like, they had to be specially bought out of the country. And, you know, of course, doing something like that is way outside of the norm. So you had to go to these special doctors who were willing to do that kind of
Yeah.
stuff. And this lady was wrecked. I mean, her tissues were just shot, and, like, she'd gotten a bad infection. I just had to pull them all out. And, I mean, it was just a disaster. And so, you know, that's kind of an example of when these things go wrong. And then, too, the other thing about, you know, doing too much when you're young, and we talked about this either last week or the week before.
Right.
When I think it was a couple weeks ago, when you start doing a lot of procedures like in your 20s, people are going to assume you're older.
Yep.
They're going to assume you're 30, 40. You know, remember the girl that got accused of being 45 when she was 22? You know, I mean, that's one of the potential downsides as well, excluding the actual potential dangers to your body.
Yeah.
So, so I just wanted to kind of go over, you know, what I, as a plastic surgeon, might advise people in their 20s is okay versus not okay. And I tell you, when I say things are okay, it's not because I'm trying to get business. I mean, this is purely educational and just based on my experience. So, you know, in your 20s, I think for sure skincare is a great thing to do. In fact, you should start that in your teens because that can give you many benefits down the road if you take care of skin. You take care of your skin, it'll keep you from aging prematurely.
Yeah, we did an episode on that.
Yeah, right.
Skincare.
Yeah,
steps.
skincare routines. Yep. As far as breast surgery goes, and I mention that because she's had so many breast surgeries, and I think that's one of the things that she, you know, maybe regrets doing. I mean, it is okay to get breast surgery in your 20s. There's two things to think about, though. One, when you end up having kids, if that's what's in the cards for you, your pregnancy could affect your result. Not could, it will affect your results, almost certainly. And so you're obligated to have another surgery down the road. The other thing about getting breast surgery when you're very young is I encourage people not to go crazy. You know, don't get giant implants. Like, your body's going to change. Then you end up getting another surgery to fix them. And that's probably the rabbit hole that she fell into. Is she got these big implants and something happened. She's got to do another surgery. You know, if you're going to do something, be conservative. I mean, it pays off, and it's hard to think about that like in the now, like, oh, if I do this, it'll be better for me in 10 years. But 10 years goes by fast. And,
I'm a prime example. But I haven't had to get mine redone yet, though.
oh, yeah. Yeah.
I got mine done when I was like 21.
21, yeah.
Yeah.
Yeah, I mean, so you're a good example of how it can work out fine.
Yeah.
Right? It can work out fine, you know, and so I'm not
But
telling...
I got mine look like they fit my body.
Yeah.
They're not like,
You made wise choices.
yes.
Atta girl. All
I'm
right.
21.
That's pretty good. I'm not sure I made wise choices in 21.
No.
Yeah, moving on to other things that people in their 20s that is, you know, acceptable. I mean, Botox, 20s is a little early, maybe late 20s, you know, 28, 29, just to prevent those wrinkles from ever popping up. I think that, you know, getting Botox is fine. You know, at 20 or 21, you're probably way early for it. You know, late 20s is kind of when people start. Fillers, the only filler I think 20-year-olds might do would be lips, but if you do it, please do it conservatively. You know, it's so easy to get too much lip filler and get that artificial look, and then people are going to think you're 35 or you're 40.
Yeah.
You know, and I'm not encouraging young people to get lip filler. I think it's okay to do if it's done smartly. Outside of that, I wouldn't necessarily recommend people do fillers like in the place that older people get it, because it's just going to make you look older.
Yeah.
Avoiding the sun as much as possible, avoiding tanning beds. You know, once again, it's hard to think about, you know, the future and, you know, doing this now is going to help me in 10 or 15 years. But boy, the sun does really, really affect how much your skin ages. So, you know, avoiding that is a
And if
good
you're
idea.
still going to a tanning bed,
Yeah, tanning beds are bad. I mean, I went to tanning beds, so I'm not gonna like beat anybody up about it because, back when I was growing up, like being tan was like definitely in vogue, and I remember me and my wife used to go. We had like memberships to Planet Tan, or I can't remember what they were called. Palm Beach, yeah, I don't know. And I mean, it was horrible for my skin. It's amazing I don't look like a saddlebag, but yeah, I mean, learn from my mistakes, I guess. And then finally, facial treatments. So that's the one thing that people might be surprised. I do think facial treatments are fine in your 20s. We actually have a pretty big clientele at our place that do them. There are a lot of benefits of doing facial treatments, whether it be hydrofacials or microneedling or lasers. I mean, it can correct stuff like acne scars. And so I don't think that's going overboard because like things like that aren't going to, you can't really overdo them. I mean, I guess technically you could, but you don't ever look at someone and be like, oh, that person's had too many laser treatments, right?
Yeah.
We never say that. It's always like that person's had too much surgery, too much filler. So, if you're in your 20s, I do think that those facial treatments are potentially beneficial. I mean, it might be a little early to start them, but I mean, I don't think that that's necessarily the worst thing ever, so.
Yeah, like that's like if you have to do something.
Have you ever done any of those? I'm sorry, I don't mean to like pry if that's not something you want to talk about.
No, I've never done one.
You haven't done them.
But obviously, you did Botox.
I did your Botox,
Yeah.
which you like your Botox, right?
Yeah.
Yeah. Let's see, lift your eyebrows up. Oh yeah, you look good. Yeah, it looks good on you.
I interviewed a hip hop artist last week, and she told me that somebody in the room had a question for her that said, "Has you ever had like a plastic surgery that you regret having?" And she said she's in her 20s. She said that she regrets having like the plastic surgeries that she's had because once you hit 30, then you kind of like put on like more weight or like
Your body changes.
Yeah, your body changes.
Yeah.
And she was like, I wish I had waited till after to do certain things.
Yep.
Yeah, I do agree with that. I mean, I do think that it's best to wait till you're 30, and mostly for women because of childbirth. Yeah, childbirth. Like, if you get all these plastic surgeries done early and then you have kids, like you have to redo them all almost.
Right.
Yeah.
And so, then it's always hard to, I mean, I do tons of revision surgery or redo surgeries, but it's always harder to do the surgery the second time than the first.
Right.
And so you're more likely to get that great outcome if you just do it once. And so that's why I encourage young people to hold off on plastic surgery. I don't think it's crazy to do it though. So, I mean, I'm not saying, if you're 20 going out and getting a breast aug that you're, making a bad move. It can be done correctly as, we talked about with Sarah, but you just have to be careful.
Absolutely.
You have to think about these things.
Yeah, I feel like you have to think about like your lifestyle.
Yeah.
Because like I knew that I was going to stay active and like.
So you didn't go
I was
crazy
like a
implants.
I'm a
smart.
naturally like active person. I have an active lifestyle, so whenever I got them, I didn't think that my body was going to change that much. I knew I was going to have a kid, but
yeah,
I was
see,
like,
I mean, you made smart choices,
Yeah.
and honestly, I think it's up to the surgeons to really bring these things up, and I don't think they always do.
he warned me.
Oh, he did. Okay,
Yeah,
good.
he told me, he was like, if you have kids, and you plan on breastfeeding, like this
Yep.
may get in the way. But
Okay, that's
the best
good.
possible outcome is.
I'm not sure all surgeons like are that honest because I think some of them don't want to scare off a client. I mean, I am always like, oh well, if you're 22 and get a breast aug, remember when you get pregnant, this may all just go downhill. And if they still are up for it, then I'm like, okay. I mean, fair warning. So, but yeah, that's interesting. So with Katie Price, I mean, anybody who's done something and then wants to warn people about the downsides of it, I'm not going to beat them up about that. I mean, even, people were giving her grief because she's, had all this surgery. I mean, she's actually a good person to talk about it.
Yeah.
And, I think she's telling people absolutely don't do anything. And I don't necessarily agree with that, but I do agree that you need to kind of take these things into consideration before you jump into it. So,
Yeah.
all right. Smart. Learning stuff about plastic surgery right here. It's happening now.
Yes.